when you talk about the 80% of patients being treated in the community setting as opposed to the academic medical centers, that the well-known names that we'll know, like the Mayo Clinics, the MD Andersons, who are the centers for the research and innovations that are coming out in healthcare. The one thing that hinders is the workflow, right? Because you don't have the same number of experts in a whole hospital system dedicated to treating cancer, and a whole division with staff dedicated to treating one type of cancer. These doctors in the community setting are going to treat every patient that walks through the door, and it can be really difficult to keep up with all of these innovations, all the new findings, the indications of these tests. What needs to happen for today's clinical workflow to accommodate and scale the practice of precision medicine in oncology?
Yeah, I love that question. This is a really great one, Rome. And I think that if you want precision medicine at scale, you just cannot rely on heroics from one enthusiastic oncologist at an academic medical center, right? You have to really bake it into the workflow in a way that it is standard of care that everybody actually can easily follow. And what that means is reflex testing, for example, where the lab automatically runs the right panel when a certain cancer is diagnosed, right? Instead of, you don't want to have to wait for a special order. It also means that the reports have to be extremely clear and land directly into the EMR, like the electronic medical record, with a simple, like, well, this is what it means for the actual treatment of that patient. And this is what actually needs to get done for the patient. And it also means some kind of team-based model where oncologists and pathologists and genetic counselor can all get aligned, so that the patient hasn't to really, the patient or the oncologist doesn't have to stitch that story together, themselves. So there is a lot that needs to happen, but it is really starting to happen more and more. And this reporting, I think, we cannot understate how important reporting is. The fact that ultimately, once you have the test results, you need to know exactly what it means and how you can manage that patient.